and welcome to Facebook Live.
Hello, hello.
Dr. Brie and Kat here today to talk to you about what we have learned in 3 years of our Healthy Living program and learning about prescribing GLP1s.
Yeah.
Since it's such a hot topic.
It's been a journey.
It has. It has. So Kat was a forerunner at our practice saying, I'm really interested in nutrition and helping guide people through that and helping people with weight loss and meeting their health goals. And I said, that's great because that is not my wheelhouse. What have you liked about it? What have you liked about the Healthy Living program and adding in that tool?
Yeah, I mean, I really like watching people being able to hit a goal or or smaller goals along the way and get to that large goal, whether it's a weight loss goal or metabolic function improvement or improving muscle mass. And it's so nice to sit with patients and hear what their goals are and what their journey's been so far and kind of helping them in the next phase. And I find that the GLP-1s are a tool in that toolbox that we have. I never, talk about them as like the easy button because it's like one piece of the puzzle for getting to where people want to be.
Absolutely. I remember in med school how they taught us, or somewhere along the way, probably residency, there was evidence that showed that just saying at an annual visit you should lose weight and moving on actually doesn't work.
Yeah, it turns out.
Turns out, evidence-based. And that like having a visit dedicated to helping somebody meet those goals, whether it's their weight or their body composition or getting back on track even with exercise, if you have a dedicated visit to that, that is definitely proven to be helpful. So to me, Healthy Living made so much sense where we carved out that particular topic.
Right.
And your first visit for that is an hour.
Yeah, and it does actually take that hour.
Yeah.
Because I want to dive into the history, what they've done in the past, what's been successful, what hasn't, what they're doing right now, what their goals are, and then helping to formulate a plan. So every patient is totally different in what their recommendations are and what their goals are, and
And then you have the accountability piece, right? And then they
Yes.
come back and say like, well, this worked or didn't work. And then that visit is where you also talk about, is this person a candidate for a GLP-1 medication to support that weight loss from a pharmaceutical perspective? So, how do you kind of decide and how do you decide on the different options? There's so many options now. There's semaglutide and, Ozempic, and there's tirzepatide and Mounjaro. Those are, two big buckets, and then now we have the Wegovy, and that one is which one again? That's the
Wegovy semaglutide.
Yeah, and then the Zepbound is
tirzepatide. Yeah, the brand names are marketed towards if you're diabetic or you're not.
Okay.
So Mounjaro and Zepbound
Really
are actually
confusing.
the same medication.
Yeah.
It's just like one is for diabetics and the other one is not.
Got it.
Same with Wegovy and Ozempic.
Yeah, it gets very confusing. And then there's the whole microdosing and the compounding. So how are you now you went from one tool in your bucket to all these different tools in your bucket. So how do you match it up with the person?
Yeah, for sure. So sometimes patients come in knowing that they want to be on one and also which one they want to be on because they've had friends on them or family members. And so sometimes patients come in and they're very clear, and other times patients are like, I kind of thought about it, but I'm hesitant and I'm not sure. And a lot of times it comes down to cost because the semaglutide is certainly less expensive in the compounded version. And so that oftentimes will make the difference if a patient's not sure, they don't have a preference, but cost is a concern. That's what we'll start with, and then if it's not working well, then we can move to the tirzepatide or Zepbound. And then like the question of like dosing or not dosing. Certainly if people are getting it covered by insurance or we're using like a direct to patient program, we start with the lowest dose possible.
Right.
With compounding, we have a little bit of wiggle room to start even lower. So for patients who are hesitant about side effects or want to see if like a little small dose would get rid of if they've got like belly fat or they're just trying to improve their body composition but not necessarily losing a larger amount of weight, we can definitely start with a smaller dose. My approach is always the smallest dose possible to get the results that you want.
Right. Well, I think that what I've seen and something that was new to me about maybe 6 months into healthy living was the articles around inflammation reduction and help with like arthritic conditions and pain.
Yeah.
And I know one of our kind of early pilot patients was a normal weight person who had some body composition changes during menopause, but really had orthopedic pain after multiple surgeries in an extremity. And within a short amount of time on that kind of microscopic microdosing scale, which is you don't really want the weight loss, right?
Right.
And I remember you and I saying, ooh, we don't want the
Right.
weight loss in this circumstance, but we want the inflammation reduction. And within a short amount of time, I mean, the pain was gone. I was so impressed.
Yeah.
Have you seen that repeatedly
Yeah,
on
and that's
inflammation and pain?
That's probably the number one unintended side effect that
Mhm.
I have patients come back and tell me is joint pain and then feeling bloated or inflamed.
So cool.
And it
It's
is
better.
It's
Goes
better.
away. Yeah.
Yes, and it's probably the number one reason why people stay on them when they reach their
Yeah.
goal. They want to have that.
Yeah.
The second one is food noise. So a
Mm.
lot of people suffer from like constant chatter in their brain of like, what should I eat? When am I going to eat? I ate too much. I'm feeling bad about myself because I'm eating again. Kind of that
Yeah.
like constant reel going through their head, and that shuts off with the GLP-1s, and it like feels very freeing for a lot of people.
Yeah.
So that's the other reason why people will stay on it afterwards.
Well, and that's why we're seeing now the studies around addiction, right?
Yes.
And alcohol reduction and addictive behaviors being treated
Yes.
with GLP-1s because of that noise.
Because of that noise. Yeah.
It's fascinating.
It's such an interesting
So
medication.
another offshoot
Yes.
from the branches of
Yeah.
the GLP-1s. I found that was kind of unusual, but makes tons of sense that would be related
Yeah.
to kind of that treating the brain. The other interesting one that you and I have been keeping our eyes on because of our brain health interests, at least me in particular, is the neuroinflammation and the potential for help in Alzheimer's. I know that study didn't quite succeed with Ozempic or semaglutide.
Right.
I'm being preventative, but I still have my ear to the ground on that because I think from a diabetes of the brain perspective and knowing that metabolic syndrome can lead to vascular dementia when you have high cholesterol and prediabetes, that can lead you down the vascular dementia pathway. If there's any potential benefit on the Alzheimer's side too, then we have two different dementia pathways
Yes.
that could be benefited from lowering your metabolic syndrome. So
Yeah.
that certainly got my attention. But the metabolic syndrome that we used to talk about, I feel like that responds really well, not just along weight, but along actual markers like your prediabetes
Yes.
and cholesterol. What have you seen there?
Yeah, so the first things I always see go down triglyceride, cholesterol, and hemoglobin A1C.
Mm-hmm.
And then usually after that, LDL cholesterol too. So people have like really cool markers that reduce.
Yeah.
And then the other really amazing one that I always tell people, to me, is the most important one that reduces is the visceral fat. So adipose tissue in the abdomen. And we see that on our body composition.
Yes.
And that one, like that type of fat does lead to metabolic syndrome or insulin resistance.
Yep.
And so even if people don't have a high A1C or they don't have like they're a quote unquote normal body mass index, I have a lot of patients who their visceral fat is the concern
Yep.
in prevention of elevated blood sugars, fatty liver,
Yeah, later in
cholesterol.
life. Yeah.
Yeah, and
Yeah.
so targeting that with a GLP-1 can work really well as well.
I remember when we first did our continuous glucose monitoring trial, we all tried them and like got to actually see, patients start using these continuous glucose monitors for health and prevention. And I saw the people on the GLPs, the blood sugar between like 83 and 107, like all day, every day. Yep. And that's when I realized, oh, that's how these meds actually work.
Yep.
This is how they prevent, problems with your brain. This is how it protects your inflammation,
Yep.
right? Because blood sugar fluctuations are such a driver
Definitely.
of inflammation and chronic disease. And that's the root of so many things. So it makes tons of sense that,
Yeah.
that's a primary mechanism for how they benefit people. So talk to me about the body composition scale and what you've noticed, because then we have the side effect discussion. I'm sure people are going to be concerned about that. And one of the big things in the media is the sarcopenia, the loss of muscle mass. And we know we want people to lose weight, but we don't want them to lose their muscle because we don't want to have frailty, just like we don't want to have obesity, right?
Correct.
They're both reasons for problems later in life. So what have you noticed?
Yeah, so my number one conversation that I have with all patients is we do not want to lose muscle along the way. So I am not about giving large doses to lose weight really fast because you'll lose a lot of muscle. So it's going to be slow and targeted and intentional of losing the fat without losing the muscle. And we've had the majority of patients maintain their muscle or lose like a half a pound while losing like 30 pounds of fat, 20 pounds of fat.
Wow.
And really, so that is built into the Healthy Living program. The body compositions, my ideal is that patients are doing them every 3 months so that we can really keep track of like what's going on with the fat versus muscle and making sure that that muscle is staying on the frame, and then utilizing like focusing on protein in the diet, focusing on strength training. And for some people, for some of the patients who have never exercised or that's not, you know, something that they're doing, that can start with like walking with a weighted vest, you know, just slowly thinking about how to keep muscle on your frame, and then moving into strength training and lifting and things like that.
Yeah, absolutely.
And so that is my goal for everyone, is that we don't lose that precious muscle, because that also comes with problems down the road.
Well, and that's why you have the coaching along with the Healthy Living assessment, right? Because the difference between getting a GLP-1 in a program like ours with the Healthy Living guidance with a medical professional versus like at a boutique spa or their friends who happens to have extra. There's a lot of interesting things going on with this medication, and it's still a medication. It's still really important to have it monitored, to know the dose that you're taking, to know exactly how much you're getting, to make sure you're getting a quality, reputable product, especially if you're not getting something made by the pharmaceutical company. I've seen all sorts of weird things going on. So, you know, to me, it's really great that you focus on the diet and the lifestyle and the protein and the activity, because this med in a silo isn't a home run, but in the context of, you know, a true medically supportive environment targeted on your goals, I feel like it can be a home run.
Absolutely. Yeah, again, it's a tool, right? It's like one thing, you know, but you have to have the other pieces in place to make it successful.
Absolutely. So other side effects that people need to look out for, I mean, obviously they should talk with their individual provider or join our practice and our Healthy Living program to get more specific. But
the big ones are GI side effects. So like nausea, constipation, diarrhea, vomiting are the top ones. But again, doing it in a slower approach where you're, you know, titrating the medication up tends to have less, and then, you know, supporting it with nutrition changes and, you know, supplements as needed, or, you know, help to kind of move through those side effects, because they usually don't last forever.
And then I think the most common question when I'm talking to a patient about, I think maybe a GLP might be a good consideration for whatever it is they're complaining about, perimenopause, belly fat, you know, joint pain, inflammation. We talked about a couple of those, but is, you know, am I going to have to be on it forever? And how do I get off?
That's the big question everyone has. And so I don't know is usually what I say, because everybody's so different. So we've had patients who can get off of them successfully and stay off of them. Most patients fall into the bucket of needing a little bit either they're like really tiny doses every week, or they do a dose every 3 weeks just to like stimulate that hormone again. And then other patients will need a significant dose once a week forever, because it's a chronic illness. It's a chronic disease. It's so I think if we think about, if you're talking about obesity, that is a chronic disease, and like other diseases, you need the medication, you know, moving forward. For patients who maybe it's less weight or like perimenopause, belly fat, maybe they won't need it forever. The majority of patients actually stay on it because of the unintended side effects that they're seeing that are, you know, again, there's no study that says like reduces inflammation, it's a slam dunk, but that's what patients notice is, you know, less joint pain, less feeling inflamed, less bloating, and they like that and they stay on it for those.
Yeah, they feel better.
Yeah, I do think that patients who have the most success with staying off of it are the ones who have done the work of like boosting their muscle mass, you know, continuing strength training, increasing protein that they can keep, because the more muscle you have, the better your metabolism works to burn the fat. If you haven't done that work alongside it, it's not gonna, you're not gonna be successful.
Yeah, it's like with the testosterone, I just tell people, like, it's gonna be a helpful tool to building muscle mass,
Right.
but you still
But
have to do something.
Exactly.
It's not just gonna put muscle on you. You have to,
Exactly.
like, utilize it.
Yeah.
Well, anything else that you learned with the Weightless book? We did this as a follow-up to our book club with Weightless. We'll put the link to the book in the comments, but it was really great. Dr. Rosaria
Salas Whalen.
Salas Whalen, yes. How did that book kind of help you have insight on your program?
I think for me, it highlighted the importance of those body compositions. And so before I was like, oh, we could, you know, if you're interested, we could do one. And now I've kind of changed how I'm saying that. Like, let's really do one in every 3 months.
Yeah.
Just because that muscle piece is so important. So that shifted things a little bit for me. And then just the, you know, I loved how the book reinforced the things that I've been talking to patients about already.
Very validating.
Very validating, yes.
You developed a great program out of your medical expertise and knowledge and years of working with people.
Yeah.
It's not like, and these tools have been around in our career since I was in residency.
Same.
I mean, they've been around for a long time.
They have, and I think that's the other piece people get nervous about is like, these are new medications and we don't know.
Not new.
They've been around 20 plus years, and you know, there's great long-term data on them.
Yeah, I think that's great and really reassuring too. So hopefully this answers some of your common questions. Feel free to reach out to us if you have additional questions about GLP1s or our healthy living program. Thanks so much. Have a great day.
Bye.